In the wake of the mass shooting that happened in Buffalo, the state's Office of Mental Health is providing necessary resources to help New Yorkers heal. The office says what happened in Buffalo was of colossal magnitude and requires a long-term healing process. News Channel 34's Amal Taliji has more.
I don't want to pretend that anything I say today can blunt how horrible and how horrifying this is. And we know together that the only way through is with each other.
Associate Commissioner for the Office of Mental Health, Sarah Kiriakos, says everyone who is touched by a disaster is affected in some way. It's normal to feel stress, anxiety, and grief.
It doesn't mean you'll feel this exact way forever. Most people feel better over time. Most people are able to call on coping skills and supports. And it's important to watch out for yourself and for others so you can seek additional help.
The office discussed the effects that racism can have on a person's mental and physical health. Furthermore, they identified some ways to cope with racism and racial trauma. This includes finding a mentor, talking about the experience, identifying specific triggers, and possibly getting involved in activism. Dr. Sydney Hankerson, who was also the director of mental health equity research, says when it comes to recovery, people in the Black community are more likely to reach out to informal networks like family members or faith-based leaders.
And calling in these informal leaders. I see somebody talking about barbershops and beauty salons. Absolutely. And also thinking about how we can engage our youth through sporting events and schools and other trusted networks is critical.
The office says racism can impact mental health, and if you're struggling, you're not alone. You can text GOT5 to the crisis text line at 741-741. A trained crisis counselor will respond within minutes. Reporting at the Capitol, Amal Taliji.